So hello there, we are here with my lovely guest who is Samantha, and we are going to do a little bit of introduction regarding how to treat the pregnancy here in the United Kingdom. So now I would like to ask you, please introduce yourself a little bit, because I know you are a very highly expected midwife, and also you are a teacher, so tell us a little bit about yourself.
Well, I'm Sam. I have worked as a nurse in the NHS, and I'm currently working as a midwife, and I also work as a lecturer in midwifery as well, so I know a fair bit about midwifery.
Yes, so my ideas came from because the difference between the two countries, between the two procedures is so huge. I think it would be beneficial for not just for the Hungarian, for other people who are coming from different countries. So I really appreciated that you're going to a little bit explain how the system works when, for instance, a woman discovered she's pregnant. So how she needs to behave in this country.
So in the UK, when a woman discovers that she's pregnant, generally she'll pop along to a family doctor or a general practitioner. She normally confirms the pregnancy herself at home with a home pregnancy testing kit. However, the doctor will also test for her as well, should she need to. You can also get free pregnancy test kits from your pharmacy or chemist as well.
Are they free?
They are.
Lovely.
Once she's been to her general practitioner, the doctor will then refer her to a community midwife. So she'll then be under the care of the midwife. Visits normally take place either in a health centre or at the GP surgery. Mm-hmm. And if it's your first baby, you can expect to have about 10 visits by your community midwife.
Lovely.
And then 8 visits if it's not your first baby. So we try to encourage women to go to their doctors as soon as they think they might be pregnant, so that they can book with a midwife early. The first visit that they have with a midwife is very important. It's called the booking visit. And generally that involves the midwife sitting down with the woman and her partner and going through the woman's medical history.
So it's with the partner together?
With the partner as well, and explaining the plan of care for the pregnancy. Mm-hmm. At booking they'll talk about medical history, and they'll also explain what's going to happen during the pregnancy and what she can expect.
Alright then.
So the midwife will actually book the woman in for her care, which is why it's called the booking visit. Mm-hmm. The woman can decide whether she wants to have her baby at home or in the hospital or in a midwife-led centre.
Lovely. So it means this midwife will deliver the baby later on?
No, not necessarily.
Not necessarily, but if there is a chance for this?
Possibly, if the woman elects to have a home birth. Mm-hmm. So once the lady's made the decision where she wants to have her baby, the midwife will arrange to see her again and book her in for a scan at the hospital to date the pregnancy. So
the lady needs to decide she would love to have the baby delivered at home, mm-hmm. and has to be decided on the very first visit?
Not the very first visit. The midwife will,
but as soon as possible,
screen the woman to make sure whether she's low or high risk. If she's high risk, she'd be recommended to deliver baby in a hospital.
Oh, that's fantastic.
So around the first visit, or possibly the second visit, the midwife will talk to the woman about what she can and can't eat in pregnancy. So normally the foods to avoid are any blue cheeses or cheeses that are unpasteurised, uncooked meats. Must make sure things like eggs are hard boiled, to wash fruit and vegetables, and obviously not to take any medication in the first 3 months of pregnancy unless advised by a doctor.
I have one very important question, just to compare the two systems in Hungary, because in Hungary when somebody is going to be pregnant, the person is immediately contacting the doctor who is going to be delivering the baby, because in Hungary the doctors are delivering the baby. I know here is different, that's what makes me think to do this video, because it's a huge difference. So how just put it in a straight way, the lady doesn't see the doctor immediately, so she is contacting with the midwife, not with the woman's doctor.
Well, we've got a special system of care in the UK. The general practitioner doesn't deliver babies, which is the family doctor. Mm-hmm. It's either the midwife that works in the community if the woman has a home birth and the midwife is on duty that mm-hmm. day. It's either a midwife working in a hospital or a maternity unit. And there's also a special group of doctors called obstetricians that deliver mm-hmm. high-risk babies. So if at the first visit the woman is deemed to be high risk, the community midwife that initially sees her will refer her to a specialist at the hospital, and they will deliver her baby.
So in Hungary neither we don't, I just mean the lady sees who is going to be the doctor deliver the baby, no matter if it's a high risk or not. So the GP in Hungary has a very little impact in this process.
So in this country you can either be under the care of the midwife or you can be under the care of the consultant, depending on how high risk your pregnancy is.
One question, if you don't mind, to interrupt your lovely speech. In Hungary, the women are able to choose the doctor, because we're not speaking about also the midwife as well, but the midwife has very little, I think very little impact in this process. So the doctors are in charge, and the women are choosing the doctors in a very early stage. And can the lady choose doctor or midwife, or is been already done, so it's who is the nearest one, then you have to go there?
Well, the woman's normally allocated to a team of midwives who deal with her, so she won't just deal with one midwife, it will be a team that work together. If the woman's high risk, she'll be allocated to a consultant, and it's normally the consultant that specialises in her field of whatever the problem the woman has. So if it's a twin pregnancy, then it will be a consultant that specialises in multiple births.
Oh, fantastic. One very silly situation back in Hungary, but it's good to compare to the UK system. In Hungary, unfortunately, if you pay more to the doctors, I'm sorry to say for everybody, as in a pocket money, as a trip, but we're talking about a lot of money, unfortunately, so it's kind of legal by the government, but it's very bad for the patient. So the lady, if they want to have a special care, a very good doctor, she would love to pay, she must pay a lot of money. How does it work here? Does it work this kind of, I wouldn't say corruption, but it's not a healthy system?
Well, obviously NHS care is free, so everybody gets the same treatment.
In Hungary as well, it's a very weird situation, because yes, there are private practice in Hungary as well, where you can be. But even if you go to the kind of NHS in Hungary, which should be free, you have to pay a lot of money.
Oh, that doesn't happen here.
Okay, but there is a private practice as well, or in this field you can't?
You can have your baby delivered in a private hospital, and you can have an independent midwife deliver your baby.
You have to be very rich.
You have to be rich, and also an independent midwife is not insured. So if your birth goes wrong, you cannot sue them. So lots of people choose not to go down that road, because the NHS will cover them if there's a problem.
Thank you, that's very, very useful information.
Lots of women pay to have extra scans. They pay to have the 3D scans, 4D scans, which mean they can see the baby in more detail, and they pay to have extra investigations to put their mind at ease. But other than that, all the care is free.
So if somebody wants to have a 3D scan,
that's not on the NHS, but everything else is. So once the lady's had her pregnancy confirmed, she'll then have a dating scan. She'll go up to the hospital, or in some cases they scan in the community, so there's a clinic where there's a midwife that does the scanning, and they will tell her the estimated date of delivery. They will measure the baby on the scan and give her a date.
Is it the booking, the first one, or afterwards?
After the booking, normally around 8 to 12 weeks.
It's not necessary in the hospital, it's in the community area.
As well. All ladies have 2 scans in pregnancy, one to date the pregnancy, so as soon as she finds out she's pregnant, and the other one at 20 weeks in order to check for abnormalities with the baby. Some ladies need extra scans to check for the baby's growth, if there are concerns with the baby not growing properly, and some ladies pay for extra scans to put their mind at ease. But if everything is normal, you will only have 2 scans. So after the lady's had her scan, she'll normally see her midwife again around 16 weeks, and the midwife will talk to her about whether she wants to have some screening tests done to check for conditions like Down syndrome, and they'll also take a load of bloods from her as well to look for her blood group. To check her iron level, to check for infections like hepatitis, HIV, syphilis. They'll check her rubella immunity as well. If the lady's blood group is rhesus negative, she will have injections of anti-D in order to protect the baby from the antibodies.
So if it's negative?
Negative, rhesus negative. So the midwife will then see the lady again around 20 weeks and have a look at the scan that's been done, and then she'll see the lady again about 25 weeks, and she will start measuring the woman's abdomen to make sure that the baby's growing, and she'll use a tape measure to do that. So the midwife will see the woman 10 times over the 40 weeks,
as you said in the
for the
beginning.
first pregnancy, and at every visit they will check her blood pressure, they'll check her urine, and that's to check for preeclampsia, which is a life-threatening condition that can hurt the mother and baby. It causes raised blood pressure and protein in the urine. And also they will ask her if she's feeling the baby move, and they will ask the lady how she's feeling in herself as well. From 20 weeks they can listen to the baby's heartbeat with a little handheld device, so the mother can hear as well.
At the community?
Yeah, the midwife will do that. Yeah.
So after the 20 weeks?
After 28 weeks the midwife will retake some bloods as well. They will test the lady's iron level again, and they will also check for any antibodies that might have developed in the pregnancy. So if she needs iron, they will give her some iron tablets in order to make sure that she's not anemic for when the baby comes. At every appointment they'll go through the importance of diet, avoiding alcohol throughout the pregnancy, avoiding smoking. At the start of the pregnancy, I forgot to mention, they'll check her carbon monoxide level as well, and if she does smoke they'll refer her to people that can help her stop smoking. So every time the midwife sees the woman, she'll talk to her about keeping fit in pregnancy, so she'll recommend some exercise classes that pregnant women can do. She'll talk to her about her benefits, so from 25 weeks pregnant she can sign her MAT 1B form, which entitles her to receive maternity pay. She must declare that to her employer so that they'll pay her.
Fifth week.
Yeah. And there's lots of websites that parents can go on to that advise them on how much they'll get paid and what benefits they're entitled to as well.
Okay then, so are we now with, for instance, delivering the baby?
When it comes to around the time of delivery, just before, the midwife will ask the woman to have a birth plan in mind, so to think about where she wants to have her baby if she's not already decided. Can be there. And to talk to her about how she wants to feed her baby, whether she wants to give the baby breast or whether the baby is to have a bottle. And she'll talk to her about keeping active in labour and being mobile, eating and drinking, staying upright. And she'll also advise her on safety as well, with car seats as well, making sure that the seat is below and above the bump, so that if she has an accident she's not causing trouble.
Now the lady decided, okay, she would love to go this route or that route, so what's happening now? So
first of all, if she's not had a baby before, the midwife will ask her if she wants to have parent craft classes to enable to prepare her for the birth, so she knows what to expect and what pain relief she can have. And then when it's time for the delivery, the woman has made the decision where she wants to have her baby, so the midwife will go through the signs of labour with her and tell the lady when to call up for help or when to come into hospital. So when the lady goes to have her baby, normally the midwife will deliver the baby unless there's a problem.
Still, we haven't seen the doctor.
Don't see the doctor
That's a
unless
huge
there's a problem.
difference. Absolutely.
If the lady is having twins or she develops a problem in the pregnancy, then she will not see a community midwife, she will then see the doctor instead at the hospital. But she will only see the doctor if there's a problem.
If it's a need.
So most women are cared for and have their babies delivered by midwives. She might see a doctor if there's a problem in labour.
Lovely, that's fine. Excellent. That's what made me to do this video, because in Hungary, if you don't see the doctor, everybody is panicking. So when she has her baby, she can go home the same day if everything was straightforward and normal, or if she wants, she can stay for overnight or until her and her baby are well enough to go home. Okay. So she can stay only one night, extra night, unless if it's...
Most people stay overnight, because when she goes home, the midwife from the GP surgery, the team of those midwives will care for her at home.
Yes, I was doing one interpretation in this situation. In day of... They
normally see you the day after you go home from hospital, and they visit up to about 28 days post-delivery. But most women only need 3 or 4 visits, and then they...
In this 28 days?
Yeah, then they're discharged to the care of the health visitor. And the health visitor's a special nurse that's trained in looking after babies and children. So they normally look after the baby until the baby's at school.
That's still very interesting for me. We haven't seen any doctor in this process.
Yeah.
Am I right?
Yeah. If she has a problem in the labour,
Yeah,
and she needs assistance with the delivery, or she has an
But
operation...
if she doesn't have any?
If she doesn't, then she doesn't see a doctor.
Exactly.
If the lady has a caesarean birth by the doctor, if there's a problem in labour or it's planned that that's how she'll deliver her baby, then she's under the care of the doctor, and the doctor discharges her home, normally after about 3 days in hospital.
Lovely. When I was doing this interpretation, when the community midwife came to see the baby, she was bringing a red book with her.
Yes, that's right. So the red book is the child's personal health record. So every time the baby or the child has an appointment at the doctor's, the health visitor, the dentist, anything like that, the parents must bring the book along with them so that notes can be written in.
Until the age of?
Until around the age of 5, until they're at school. And it's basically a record of how well that baby's growing and developing. And the pregnant woman will also have a handheld set of notes that she carries with her at all times and takes to all appointments, and they're normally green in this part of the country. And it carries all the details of her pregnancy, so people looking after her know who she is and what's happened in her pregnancy.
Interesting, when she was explaining to her what's going on now, she was looking up the smoke detector, because she said if the smoke detector hasn't fitted in, the fire brigade will come out and will do it for free of charge, because the child can't leave the premises. Is that correct?
That's right, yeah. So when the midwife comes to visit at home, they'll talk to the parents about making sure the baby sleeps in a safe position and that the baby's not overwrapped to prevent cot death. And they'll also talk to the lady about feeding her baby, making up feeds safely, registering the baby's birth. That must be done within 6 weeks of the day the baby was born.
In Hungary, when, for instance, you deliver the baby, you have to give a name immediately to the child.
No,
so how does it work
6 weeks here. 6 weeks. In hospital, the baby will have the surname of the mother.
But she's got a barcode, or
the baby will have the baby will have tags on the feet, and it will say baby and then the mother's surname. And the date of birth and the time, so we can identify who the baby belongs to.
That's fantastic. Alright then, I've been told in another occasion that I was doing interpretation by the GP, because the lady, she didn't want any baby, and the GP said to her she can get the, what is the name of the pills?
There's 2 pills. There's the combined oral contraceptive pill, and there's the mini pill or the progesterone only pill, and they're oral tablets that you take to prevent yourself having a baby, and they're free. Okay.
And lovely. What you think could be very important for women who plan? Or do you think you must explain everything perfectly, but do you think there is something what we need to mention?
Basically, the lady needs to make early contact with the midwife as soon as she finds out she's pregnant, really. Not to drink through the pregnancy, not to smoke. She needs to make sure that she follows the dietary advice set out by the Department of Health, and the midwife will run through that with her.
So that's brilliant. I'm very happy. Thank you. I would like to say a thank you with this couple of things. I hope you don't mind.
Oh, thank you.
So, thank you very much. Give me a kiss. Wish you all the best. So,
thank you.
So thank you very much for everybody for visiting us, and I hope you heard quite a lot of useful information for a very professional lady. And we wish you all the best. If you have any question, please feel free to contact us during Facebook or any kind of social network or internet. You can visit our website as well. Thank you very much. Goodbye.
Bye.